Today we're going to be talking about the roles of a cytokine storm in severe COVID-19. Cytokine storm is an aspect of immune response that may actually contribute to damaging many organs and tissues. We will be discussing what a cytokine storm is, what triggers it, and how does it contribute to serious and sometimes fatal disease. Just as a brief introduction and reminder, COVID-19 is the coronavirus disease that emerged in 2019 in Wuhan, China, and caused a pandemic. It's caused by the SARS coronavirus 2, the severe acute respiratory syndrome virus number 2. That's related to the original SARS coronavirus, as well as the Mideast respiratory syndrome and other human coronaviruses that cause common colds. So as we know, many individuals who are infected with this virus show no symptoms. Between 20 and 40 or 45% of infected individuals show no symptoms. But some people, after the incubation period, that's averaging about 5 days, but can be as long as 14 days, show mild to critical symptoms. About 81% of the patients in one study showed mild symptoms that we're all familiar with. And about 19% had symptoms that caused critical and severe illness. In total, about 40% of those showing symptoms show shortness of breath, as this is, at least initially, primarily a respiratory virus. So what are the symptoms of severe and critical COVID-19? High fevers are typical in many patients, and many patients have severe respiratory problems. And one data set showed that this contributes to about 3/4 of the deaths. And these are a variety of respiratory symptoms. Consequences, I'd like to point out the acute respiratory distress syndrome, or ARDS, which results in severe challenges for the lungs, including lung edema, which is the filling of the lungs with fluid. And accompanied are inflammatory cell infiltrates, which can be observed in X-rays as white areas in the lungs. This can lead to respiratory failure. But severe and critical COVID-19 patients have effects on many other tissues. This virus does infect many tissues in the body: heart problems, circulatory and clotting problems, and those can lead to reductions in blood pressure, which can produce shock, dysfunction and failure of the kidneys and liver, a variety of nervous system disorders. And just to say that in many of these severe and critical COVID-19 patients, there are obvious signs of immune system dysregulation, abnormal functioning and hyperresponsiveness of the immune system. This includes hyperinflammation, which is elevated numbers of activated white blood cells that are listed here, as well as inflammatory cytokines that we'll be mentioning in the blood and tissues. This is often accompanied by greatly reduced numbers of lymphocytes, including T cells and B cells, which are part of the very important immune responses which follow a little bit later and contribute, for example, to antibody production against the virus. So for an overview of inflammation and the cells and proteins that contribute to it, inflammation is normally part of the early innate immune response to infection or tissue damage. And the symptoms have been known for many years, and these are the common symptoms: redness, swelling, heat, and pain. And you can imagine them all for this poor individual who has this infected big toe. And they reflect the recruitment into the site of infection of fluid, resulting in the swelling, and inflammatory immune system cells, and local production of cytokines and chemokine proteins, all occurring with the goal of eliminating the infection and healing the damage to the tissue. So local inflammatory responses, again, cytokines and chemokines are proteins that are secreted by immune system cells and others that regulate the occurrence and the magnitude of immune and inflammatory responses. Chemokines in particular play a role in recruiting cells from the blood into the site of infection and within the site of infection and the resolution and departure of the cells from that site. So overall, local inflammatory responses are usually beneficial. Again, they fight the local infection, they're recruited into the site, they fight the infection, and they contribute to the healing of the damaged tissue afterwards. However, too much inflammation can be harmful. And this again can be seen in the lungs of individuals with severe and critical COVID-19 as areas of infection and inflammation. There are also systemic effects on other parts of the body of this ongoing inflammatory response. And we'll see more about the consequences of inflammation for the lungs of COVID patients in just a few minutes. Okay, so one question is, how do hyperinflammatory responses arise in COVID-19? Well, one mechanism seems to be through the fact that this virus inhibits early immune mechanisms that normally control or at least limit virus replication, allowing the virus to spread within the tissue in the body and continuing the inflammatory process. And so to illustrate this, we can look at this diagram. So how do our cells become infected with the virus? So we have the virus binding to a receptor on the cell surface, and then that gets internalized inside the cells, and the viral RNA genome emerges from the virus particle into the cytoplasm, results in the synthesis of new copies of RNAs that help to drive the synthesis of new viral proteins. In addition, we have new copies being made of the viral RNA genome, and together these new virus proteins get packaged and genomes get packaged into new virus particles that exit the cell and go on to infect other cells. Normally, however, our immune system provides a very early response to try to limit the amount of virus spread. And this is through the induction of proteins called interferons that interfere with virus replication. And so just to diagram the process, most cells in our body have sensors in the cytoplasm for viral RNA, recognizes these viral RNAs, turns on the expression of interferon genes, so we get the synthesis and secretion of interferon proteins. These interferons then bind to receptors on the same or neighboring cells and induce a variety of responses that inhibit virus replication. So we block the replication of the viral genome, so we don't get as much of the messenger RNAs or the new viral RNA genomes. There's inhibition of viral protein synthesis and inhibition of assembly of the RNAs and proteins into new virus particles. So this is what normally happens during a viral infection. However, coronaviruses, including SARS CoV-2, are very smart viruses, and they have adapted or evolved ways to inhibit interferon production and its antiviral activities. And so some of the interferon proteins that are made inhibit the sensors so that there's no longer as efficient sensing of the viral RNAs, and there's inhibition of the expression of interferon genes, resulting in less interferon proteins being produced. So there's less of that protein then to cause the mechanisms that inhibit the replication. So there's less inhibition of virus replication, and so we get, again, higher levels of new virus particles. And so this then results in ongoing spread of the virus in a tissue site and throughout the body, and continued then inflammation as the immune system tries to marshal its activities to help to defeat the virus. Another mechanism that we won't really spend much time on is that the virus binding to the ACE2 receptor on our cells itself increases inflammation through a variety of mechanisms that are at least partially understood. And there may well be other to be determined mechanisms by which this smart SARS CoV-2 helps to inhibit the control of the immune response and to produce local inflammation. So the consequences of the cytokine storm include inflammatory damage in many different tissues that you see here. And I'd like to focus particularly on the damage that this inflammatory response can do in the lungs, the induction of acute respiratory distress syndrome and respiratory failure. So here we have a schematic diagram of the lung where we've shown one of many alveoli that are found throughout the lungs. And these are the site of gas exchange, exchanging CO2 for oxygen that then gets distributed through the body. And so when you breathe in, the air comes in and fills the alveoli, which again are usually air-filled. And the oxygen in that intake air diffuses into local blood vessels where it's exchanged for CO2 that diffuses back into the alveolus so that when you exhale, then you're expelling the CO2. So that's the critical role of the alveoli in our respiratory processes. Now, there are a few small numbers of scattered immune system cells in the alveolus and around it, which are functioning in a surveillance mode to help to detect and eliminate any pathogens that you may be breathing in. However, in a severe COVID-19 lung, the alveolus is filled with fluid and inflammatory cells. Many of the cells lining the respiratory passages are virus infected. The cells, the immune system is not really able to eliminate the virus, which is spreading, perhaps again due to the inhibition of the interferon response. And so there is an influx of recruitment of fluid and inflammatory cells into the alveoli. And so the alveoli now fill with fluid, and they can no longer then carry out the gas exchange. And so this is what happens in the edema in severe acute respiratory distress syndrome, the ARDS. And in fact, people with severe and critical forms of COVID-19 often mention that they feel like they are drowning because of all of the fluid in their lungs. And so for individuals like this, they have to be on oxygen, maybe on a respirator or a ventilator in order to try to get the necessary amount of oxygen into their lungs. So the cytokine storm that may contribute to these hyperinflammatory responses in the lungs and other affected tissues are not new to COVID-19. They've been seen in some other infections and diseases, including other serious virus infections, such as the 1918 pandemic of flu. And here's a photograph from 1918. And the related coronaviruses, SARS and MERS, also cause ARDS and probably reflecting cytokine storms occurring there as well. Cytokine storms are seen with sepsis, which could be, for example, caused by blood-borne bacterial infections, and in certain autoimmune diseases like lupus erythematosus and juvenile idiopathic arthritis, there are periods or flares where there is, for one reason or another, a hyperinflammatory response that may have local as well as systemic effects. I'd like to mention that the effects of this COVID-19 inflammation may linger for months even after the virus is cleared from the body. So now we're some months into COVID-19, and it's clear that there are some individuals who were infected but have shed the virus, no longer having detectable virus, who are called long haulers because they continue to have ongoing symptoms reflecting inflammatory processes continuing to occur in their body, affecting many different tissues and functions in the body. And in children and youths, in a small proportion of young people who were infected at one stage of the virus, even if they no longer have the virus, they may have what is called a multisystem inflammatory syndrome that has these effects on the body. Again, fortunately, not a large proportion of infected children, but it certainly is being noticed worldwide. So in conclusion, the hyperinflammatory cytokine storm appears to contribute to the pathology of COVID-19. And what we know about it suggests some possible treatments for those infected to prevent critical consequences. So clearly, inhibitors of virus infection, virus replication, other stages of the life cycle can help to forestall any hyperinflammatory response. Antibodies, including those in convalescent plasma, may be used to either prevent infection or limit infection. Inhibitors of virus replication or other stages of the virus life cycle to prevent the progression of the disease. And one, remdesivir, you may have heard of as being now used to treat individuals with the serious but not yet fatal forms of the disease. It's an inhibitor of virus replication. But in addition, agents that block the production, receptor binding, or cell signaling of inflammatory cytokines and chemokines may be helpful in either preventing the initiation or preventing the progression of this hyperinflammatory response. The corticosteroid hormones, which are well-known anti-inflammatory drugs, can be useful, and one of these, dexamethasone, has been shown to be effective in treating individuals with severe COVID-19. And now specific inhibitors of cytokines, inflammatory cytokines such as these, that had been developed for use in autoimmune disease to reduce the amount of autoimmune inflammation, are now being tested. In addition, modulators of the angiotensin system, the ACE2 receptor, to prevent it from having its pro-inflammatory effects, are also a possibility. So many of these potential treatments are already being tested in clinical trials. I've mentioned just two that seem to have some benefit, but I'm sure more will come along. So just to end on an optimistic note, as we deal with this very, very difficult situation, a global situation, I'm confident that together the global biomedical, biotechnology, public health communities are going to figure out how to treat this condition and also through vaccines to prevent this disease.